So good morning. Thank you for joining us today at the Influenza Vaccination Kick Off. My name is Nicole Pesky and I'm the Chief Communications Officer for the North Dakota Department of Health. So today we're officially, sadly, acknowledging the start of influenza season, and we're encouraging all North Dakotans to be vaccinated against the flu. So here with us today we have North Dakota Governor Doug Burgum, Brad Hawk with the North Dakota Indian Affairs Commission, Angie Warcamp, and we also have Levi Schlosser, who is an epidemiologist with the North Dakota Department of Health. So first, I'd like to call to the podium the governor from the great state of North Dakota, Doug Burgum.
Thanks, Nicole, and thanks everyone for being here today. I know you're all here because this is an important topic, but I also know you're all here to see if I actually go through with getting my shot today. And I've been promised that if I don't cry, I'm going to get a sticker, so maybe a colored Band-Aid. It'll be good. But I want to just again say, start with gratitude and for all of you for being here today. I want to thank the Department of Health for the work that they do 365 days a year to look out for the health and well-being of the citizens of North Dakota. As you know, in our administration, we've really distilled down what we believe everyone across every cabinet agency and every part of state government and every branch of government gets up and does every day for the people of North Dakota, and that's empower people, improve lives, and inspire success. And certainly health and community health is a key part of that. I want to also thank all of our local public health units and the private sector health providers who are spreading the word about the importance of getting a flu shot. This is something that comes easily, I guess, to me through generations of folks that were involved in public health and health. As some of you may know, my grandfather, Dr. Burton Kilbourn, was Fargo's first public health official. Moved to Fargo in the early 1920s, and there's a great historic photograph of him doing vaccinations with young kids in Fargo back in the earliest days. My mother, Catherine Kilbourn Burgum, was one of the first presidents of the St. Luke's Hospital Auxiliary in Fargo, and also served 2 terms as the state president of the North Dakota Hospital Auxiliary Association. Of course, that was a group that did a lot of volunteer work to try to spread the word about public health. Personally, for myself, coming from that background, I've made it a point to get a flu shot every year for decades and decades. Sometimes it's, you don't get it. You get busy and then you wait a little while and you wish you would have got it sooner. But today, as I said, we'll be kicking off this flu season with, I think this might be the earliest I've ever gotten a flu shot is in September. But the flu vaccine does prevent millions of illnesses and flu-related doctors every year. And we may think that, hey, we're in a spot where we're past having to worry about the flu. But last year in North Dakota, there was 8,000 reported cases of influenza in North Dakota, and we know that that number is of reported. It's 8,000 reported confirmed. We know that number's low because not every person that might have the flu isn't tested for it. And if you've got the flu, you got an opportunity to help. You can put other people at risk, so this is not only for yourself, but for your coworkers, your family, and others. And we know the flu affects every age group. Even healthy individuals can become sick, but it's dangerous for some more than others. Infants and young children, people 65 and older, people who are pregnant, individuals with certain health conditions or weakened immune systems are at the greatest risks of flu complications. So again, part of what we're trying to do in conjunction with private sector and health providers and the State Department of Health is to make sure that we make sure that everybody understands the power and the benefit of vaccines. Since it's just over 100 years ago, I thought I'd spend just a couple of seconds to remind people how fortunate we are. In 1918, there was the global Spanish flu epidemic, which killed tens of millions of people around the globe. North Dakota reported 1,378 deaths in 1918. The true number was probably more between 3,000 and 5,000, and it came with great force and great intensity. On September 27th in 1918, the Fargo Forum announced that there was no Spanish flu in Fargo. That was a good thing. By October 4th, there was 100 cases. By October 5th, Jamestown reported 1,000. Nurses and doctors died. It was during World War I, of course, and so there was many young North Dakota men were enlisted in the Student Army Training Corps in Grand Forks as preparatory to service. 423 men living together. Influenza affected 2/3 of those cadets, and 29 of those died, 6 on one terrible day. So we're only 100 years away from when we were really almost in plague-like worldwide global impact. And of course, one of the reasons why we stand here today, where we're with the work of many organizations and private foundations like the Gates Foundation, we're close to almost eliminating polio in the world. Polio was a disease that struck my Uncle Howard at age 16 when he was growing up in Fargo. He was the first polio case in Fargo. So we are fortunate today to live in a world where vaccines have helped nearly eliminate entire disease categories. And the flu is something that changes and morphs, and flu vaccine has to be prepared and delivered differently each year. It certainly can make a difference. We would love to not have this year 8,000 people like we had last year who went through the agony of having the flu, and you're going to hear today from how that agony of sickness can even lead to tragedy. And we've got the courage of a family sharing their story. We thank them for being here today. It's a somber story, but it's a solemn reminder about the importance of us. When we take care of our own health, we help take care of an entire community. So again, I want to thank everyone that's here today. I want to thank the press corps that's here for helping get the word out again, and I want to thank everybody as we just passed the 100-year mark of the tragedy of the flu epidemic of 1918, to understand that things can be different now in 2019, because we've got the power and the benefit of vaccines, and we've got the ability to distribute those in a way where we can protect the citizens of our state. So thank you for being here, and I hope that all of you, if you haven't already, will follow my soon-to-be example. Get your flu shot, get it early, do it with a smile, have your friends do it, and again, thank you for being here.
Thank you, Governor. Thank you for your comments. Thank you for your support. So as the Governor highlighted, there are many populations who are at an increased risk for developing the flu. In fact, Native Americans are actually 2 times more likely to die from flu than the general public. So I'd like to welcome to the podium Brad Hawk, Tribal Health Systems Administrator with the North Dakota Indian Affairs Commission, to provide a few comments.
Thank you. Thank you for allowing me to kind of offer some comments, and for our office at the Indian Affairs Commission, a lot of our work is with our tribal communities and also our tribal populations, and so when you hear that statistic, almost 2 times more likely to die from flu or pneumonia, I mean those are numbers that we kind of see throughout our tribal communities, and so this is not new to our tribal communities with the higher rates of disease or sickness. So, but right now there are tons of efforts for getting the word out with information about what the different technologies, different things that we're pushing to get our communities educated about public health efforts, and so for us, this is one of those public health efforts that we push through our tribal communities. I know, just kind of looking at what IHS kind of does in this region, they're probably ranked in the 5th region in the nation on getting vaccinations to tribal people on our reservations, and we'd like to see that higher. We'd like to see them at the top of that. I think as you talk about our people being sick from hospitalizations and maybe the lack of services in our tribal communities, that's where we're trying to get out ahead of this, and so we're promoting that our tribal communities take this on. And so with that, I mean, I think you hear of stories with our folks not having adequate resources, and I think trying to promote the prevention side of it is kind of where we're moving. So I'd like to thank the governor for his comments, and I think through our office we're working with IHS and other partners to promote healthy communities. So thank you.
Thank you, Brad. So next, I'd like to welcome to the podium Angie Warcamp. Angie became an advocate for flu vaccinations after losing her otherwise healthy daughter, Gianna, to the flu in 2015. She now passionately advocates through a partnership with a nonprofit called Families Fighting Flu. Angie.
Thank you for having me. It's a pleasure to be here, and I'm going to try to get through this without crying. So this sassy and adorable little Spitfire right here is Gianna. Gianna loved doing everything her 12-year-old brother was doing, whether it was playing video games or basketball with his friends, even riding motorcycle. She was always right at his side. She was fearless. She was funny, and she was healthy. I am Gianna's mom. I lost a healthy child to the deadliest vaccine-preventable disease in the United States. My daughter Gianna was a healthy 2.5-year-old with a larger-than-life personality. When she passed away in less than 48 hours from the flu, less than 48 hours after presenting her first symptom of a slight fever. I am not alone. There are many other parents just like me who have lost children to the flu, and many of those parents made the conscious decision not to vaccinate. I think many people out there think that this can't happen to them based simply on the probability that their child won't be the one to die from the flu. I stand before you today as Gianna's mom. I am proof it does happen, and it happens far too often. Flu vaccination is not an individual choice, but a societal one. It is an opportunity for us as parents to show that we not only care about our children, but we care about other children and our communities in general. For communities to be free of diseases like the flu, we need herd or community immunity, meaning that everyone that does not have a medical contradiction to vaccination should be vaccinated to help stop the spread of diseases. Herd immunity is necessary to protect the most fragile in our community, including our children. My daughter, Gianna, lost her life to a vaccine-preventable disease. My family is forever changed because of the flu. There will always be an empty chair at my table. I will never know what she will look like, where she will go to school, or what kind of mother she might be. I am here today as Gianna's mom because I want others to know that the flu is serious and unpredictable, but most importantly, it is preventable. It is time we recognize the role that everyone plays in keeping our communities healthy through flu vaccination, because vaccines are safe, vaccines are effective, and vaccines save lives. Thank you.
Thank you, Angie, and thank you for bringing us into your family's story. And we appreciate you so much, and just know that we know that by you advocating so passionately that you're saving people's lives by doing that. I'm glad I don't have to go next. So next up to the podium is Levi Schlosser. Levi is an epidemiologist with the North Dakota Department of Health and is going to talk a little bit about the influenza season and how we can take preventative action to make sure, or to help ensure that we don't get the flu. Levi.
Hello, everyone. Thank you, Nicole, and thank you, everyone, for your comments. I'm just here to kind of reaffirm what they've already said and provide a little information about influenza and influenza season. Influenza season typically runs from October to May, and while cases can occur year-round, most cases in North Dakota occur between January and March. Last flu season began in October and peaked in late February and early March. Flu season can be unpredictable, so it's hard to tell what will happen for the 2019-2020 season. There are several ways people can protect themselves from the flu. Good hand washing etiquette, staying home when you're ill, covering your cough and sneezes, taking influenza antivirals if they've been prescribed for you will shorten the course of and the duration of the illness. And again, vaccination is the best and the easiest way we have to prevent influenza and to keep people healthy. Vaccine coverage estimates from the North Dakota, or NDIS, for last flu season showed that we were about 32.9% of North Dakotans 6 months and older in North Dakota received a flu shot. This is similar to average rates from across the country, but much lower than we would like to see, and so this is a number we would hope to improve in the future. The influenza vaccine is not perfect. It might not prevent an individual from getting sick. However, it is the best and the easiest way we have to keep people healthy. Thank you.
All right, now is the big moment, Governor. All right, so while they're basically putting together a little mini flu shot clinic up here, I just wanted to take a moment to thank Bismarck Burley Public Health for teaming up with us today on this kickoff event, and also wanted to thank all the local public health units, really. We have a very special relationship with local public health in that they're working right alongside of us to help create the healthiest North Dakota that we can possibly be. So I'm so grateful for that relationship and that partnership. So after these fine folks get their flu vaccination, and then we'll take a couple questions.
The suspense.
I feel like we should have some music, but I don't want to sing. I don't want to sing. Maybe the final countdown. Okay, Governor. You're up.
Which arm would you prefer?
When they say it like that.
Sitting is perfect.
Yeah.
Any problems with your flu shots?
You've done this before, right?
In front of cameras too, so. Just in case you spring over. Okay, good deal. Thank you, sir.
Thank you.
The flu shot selfie thing. Take the flu shot selfie.
So what Mike is helping the governor out with here is there's actually a national there's a national ask to ask people when they get their flu shot to take a hashtag flu shot selfie. So when you go to the clinic or wherever you go to get your flu shot, make sure you use the hashtag flu shot selfie. The governor was the first one, maybe in North Dakota.
Thank you.
Yeah, thank you. Hey.
Does he need a scissor to cut that shirt open?
So brave. All right, before we wrap up, does anybody have any questions? Any questions? Going once? Going twice? All right, thank you so much for taking the time to be here, and have a great rest of the week.